Malaria is one of the deadly ailments that has been so trivialized, especially by people in sub-Saharan Africa, who may not know that this region is home to 93% of malaria cases and 94% of malaria deaths. By this, I mean that the rest of the world outside of Africa deals with only 7% of the malaria burden. That's really worrisome. Now, according to the World Malaria Report published in December 2019, in 2018, six countries in Africa accounted for more than 50% of malaria cases worldwide, of which Nigeria has 25% of the malaria burden. Nigeria suffers the world's greatest malaria burden with approximately 51 million cases and 207,000 deaths reported annually, while 97% of the total population, approximately 173 million, remain at risk of infection, of which you and I, of course, belong to that group. Well, viewers, you are welcome to today's episode of the Health Watch program, and I will be your anchor for today. My name is Promise Njoku Adibe, and joining me in the studio to discuss this topic of malaria, the giant killing Nigerians daily, is Dr. Sunday Olatunde. He is a clinical pharmacist and a fellow of the West African Postgraduate College of Pharmacists. Good morning, Mr. Adetunde. Thank you for coming to join us.
Thank you very much. Promise for having me on the program again.
Okay. Today, malaria is actually celebrated every 25th of April every year. So it's actually not out of place to discuss this. Viewers, I hope you learn from our guest after the show. Now let's look at the big questions. Now, what exactly is malaria? How is it being contracted? And what are the different types and strains of this killer disease called malaria?
Oh, thank you one more time. Thank you, viewers from all over the world, and thank you, Promise, for having me on the program. It is today is the World Malaria Day, 25th of April, a day that has been set aside to actually drum up awareness and to commemorate the presence with us and the danger that is being experienced by nearly everybody in Nigeria and in sub-Saharan Africa from malaria scourge. So let's take a look at what malaria is. Malaria, like I said, is one of the infectious diseases. And when I say infectious diseases, they are diseases that can be transmitted from one person to another. It is one of the infectious diseases, meaning that it can be transmitted from one person to another. Other thing we need to know is that this malaria is caused by microorganism that belongs to the group we call the protozoa, and the particular name of the parasite that is responsible is Plasmodium, or we call it Plasmodia. Whatever it is, this is the name of the malaria parasite, and it has different strains. We have the Plasmodia vivax, Plasmodia malaria, Plasmodia ovale, Plasmodia falciparum, and Plasmodia nolensis. There are about 4 or 5 strains like that, and they are capable of being transmitted through mosquito as a vector. What happens is that this Plasmodium can survive in the digestive system of an average mosquito, and when mosquito, especially female anomalous mosquito, look for their blood meal, the mosquito needs blood meal in order to produce its own egg. So in the search of the meal to produce egg, the mosquito bites one person and bite another person. But before the mosquito will bite a person, the mosquito will first empty itself into the body of the person before sucking the person's blood. In the practice of all of this, or in the course of all of this, you see mosquito biting somebody who has malaria parasite in his body, whether such a person has symptoms or not, but the person carries the parasite. Why the mosquito wants to bite, or why the mosquito is looking for this blood meal, through the proboscis sucks the person's blood, and put it inside herself, or itself rather, in order to produce egg. But the mosquito will soon be hungry again to look for another one. But when the mosquito gets to the second person, it will first empty itself, the blood meal it has taken from one person, into the body of this new person, and suck a fresh one. In the course of doing this, the mosquito becomes the vector that takes the malaria parasite from one person to another. So when this has happened, the malaria parasite immediately goes into the liver of this person that is bitten by a mosquito and hides there, continue to develop and continue to reproduce. At a certain time, when the reproduction has gotten to a maximum level, you will find a situation where the Plasmodium organism will spill into the blood of the person from the liver. And when it gets into the blood, it goes straight into the red blood cell and continue its reproductive phases. When it gets to a certain level and it is well mature, it breaks the red blood cell. At this point in time, or before this point, the person will start having some certain symptoms that are characteristics of malaria. Such symptoms will include increase in body temperature, chills, like you see the person be shivering. Okay, apart from chills, apart from increase in body temperature, the individual could be having general malaise, general weakness of the body, bitterness of the mouth, or pain in different parts of the body, or general body pain. These are symptoms that are characteristic of malaria infection. So this is the little I would like us to establish when we say what is malaria and how it is contracted. That's how it is contracted. We need to also mention that apart from the way it is contracted, we have different strains, which I mentioned. We have different types of this Plasmodium organism. We have the malaria, Plasmodium ovale, Plasmodium malaria, Plasmodium vivax, Plasmodium falciparum, and Plasmodium nulensis. These are different strains, and all of them are capable of causing malaria disease condition.
Wow. Wow, that's really, really wide. Thank you very much. Okay, so you actually took that question out of me, because I wanted to ask now, from when the mosquito bites,
yes,
how long does it take for the symptoms to appear? And then you actually made mention. I wanted to ask again, what symptoms should we look at?
I will still have to answer
please
again.
Go ahead.
Okay, thank you very much. In what we call infectious disease studies, there's something we call incubation period.
Okay.
The time it takes for infection to happen, that's the time when the microorganism is introduced into the person's body, and the time the person starts feeling sick, because essentially it is the symptoms that the patient feel that makes him or her to know that he is sick or not. So the time it takes between the time of infection, or the time of inoculation we call it, to the time when the person starts feeling the symptoms, we call it incubation period. Incubation period of malaria is between 7 to 21 days, depending on the strength of the immunity of the individual. For some people, not all the times that we have infection of any sort that will come down with disease condition. There are times you are inoculated, that you have an infection of a certain microorganism, but eventually it does not result into disease condition, because your immunity is able to neutralize the infection. In many cases where the immunity is not able to neutralize the infection, that is, the microorganism now wins the body's immunity, what happens is that the person eventually will come down with disease condition. So the time it takes between the time you have infection and the time you start getting sick is what we call incubation period. Like I said, for malaria, it is between 7 to 21 days when you are bitten by a mosquito and the microorganism is able to win the immunity.
Okay, so but then why do people keep having malaria over and over again even after treatment?
Yes, there are different reasons. As a professional, we can allude to the fact that the vector called mosquito has to be controlled if you want to prevent malaria. The way I put it, that mosquito happens to be the vector, is mosquito that is responsible, because the plasmodium does not have its own wings to fly from one person to another. it has to be taken from one person to another by mosquito, or it has to be picked by mosquito from somewhere to be given to another person. So if you can, in the middle, take care of mosquito, then we will not always have malaria. But if we cannot take care of mosquito effectively, then we can always come down with malaria. At every point in time, when you have done a treatment, that's when some people feel that they shouldn't have malaria parasites in their body. That's eradication. It's supposed to be. But there's another phenomenon to that. We have different classes of malaria medicines. And some of them, in fact, the most commonly used one, are not essentially so, eradicating in their way of treating malaria. What they do is that they convert the microorganism, that's the malaria, the plasmodium organism now, into an inactive one in a way that will make the body to be able to eradicate them. So in such situation, when you just finish treatment and your body has converted the organism into an inactive one, that an inactive organism is that which cannot grow and cannot also reproduce. It is in reproduction they overwhelm the body. But if it cannot reproduce, at its latent phase, the body's immunity is going to take care of it. It's going to eradicate it completely. But when you just finish your medicine and you go to run malaria test, you are likely going to see that inactive one there. But the being inactive has stages. You may have a completely inactive one or the one that is partially inactive. And a partially inactive one can still produce symptoms in your body, because what we call symptoms are reactions of the body towards the foreign element, which is called malaria parasite in this case. So when that happens, you can still be having some symptoms. When you go there, it means that that particular microorganism, that malaria parasite, has not been completely converted to inactive one, and you can still have symptoms to that. That means your treatment is not effective. But there are still situations where you have inactive parasites that has been completely dealt with just because of the mechanism of action of the anti-malaria to convert it to inactive one, and you are no longer having symptoms. If you go to run malaria test, you will still see that. The only time you may not see it is if the type of test you run, the method they use, is that we look at the serological testing. That is that the one that is quantifying the immunity towards the microorganism. But if it is the one that they stain and they use microscope to look, they will still see the inactive parasite in it. So you have malaria, often and often control mosquito. If you cannot control mosquito, you will not be able to secure eradication of this thing. I know when we get to prevention of malaria, we are going to discuss deeper, but that's why we commonly have malaria anytime we're going to run malaria test.
But then I just want to understand something.
Yes, ma'am.
Is it medically advisable for someone to treat malaria when he or she doesn't have malaria? You just don't want to, you're scared of having this feeling.
Malaria.
You don't want to be non-productive. So
Yes.
just for security's sake, every month you treat yourself malaria. Is it advisable medically?
No, it is not advisable. The only time we will expect you to treat malaria, it is when it is evidently confirmed that you have malaria. However, it's not bad to prevent malaria. And in the rollout of prevention, there are different things we do. Medications can be used to prevent. And the type of medication that does the work of prevention, they are different from the one that does the work of treatment. So treatment is not advisable when you are not sure that you have malaria, but prevention is advisable. And how will you know? For example, you don't have symptoms. You are only scared that you don't want to have malaria. Then you can take some medications for prevention of malaria. Such medications are not taken every day. They are taken intermittently if, for example, there are people that are in the Western countries, in Europe, in America and all that, where they don't have malaria. Why is it that they don't have malaria? We must also say some people feel that it's a curse on Nigeria that we have malaria. It is not. It's because, number one, Plasmodium organisms, they have different strains. Some strains don't have capacity to harbor Plasmodium organism. So in some of those countries, the strain of mosquito they have or the type of mosquito they have cannot or they don't need blood meal, one, for reproduction, the type of mosquito they have. In some cases, the Plasmodium organisms that exist in those places, they cannot survive in a very cold temperature, because you see this is a tropical disease issue, and in the tropical, many of the tropical diseases, they need warmth, that's a certain level of temperature, before those microorganisms will be able to survive. In many Western countries, their temperature is too low that many of those microorganisms cannot survive there. The kind of mosquito some of them have, that's the type or species of mosquito, they don't need blood meal to survive. You are seeing now that in our own case, our own mosquito need blood meal to reproduce. Their own do not or does not need blood meal to reproduce. Then the Plasmodia they have over there cannot survive under 20 degrees Celsius. And in many cases, some of their temperatures goes to -4, -10 degrees Celsius, which is too low for even Plasmodia organisms to survive. Here we are in tropical Africa, sub-Saharan Africa. We have warmth, a kind of temperature. Even our body temperature is about 37 degrees Celsius. The mosquito needs the blood meal here to produce its own kind too. So because of all these singular reasons, we have the kind of environment that is burdened with malaria.
Okay, could that be the reason why, in my opening I talked about the world report that says, Nigeria is one of the countries, leading, and out of 50%, Nigeria is shouldering 25%
Yes.
burden of, malaria cases. Could that be the reason? Because of our environment, and then why did the mosquito choose to come this way?
Okay, we say we have different types of mosquito. Any country that have that type of mosquito, one, that needs blood meal to reproduce. Two, that in their digestive system, they cannot kill the Plasmodium organism they harbor. Such kind of region will have the burden of malaria. However, in our own case, we must know that we have highest population in Africa. And when you are enumerating, because of large population, if, for example, 20% of Nigerians are susceptible, vulnerable to malaria, that 20% is more than a whole country, some other countries in Africa. For example, we have countries that are just 30 million. We have countries that are just 26 million. We have countries that are, even the whole South Africa is about 60 million people. So when you talk of 20% of Nigeria, and we are about 20 million, if you talk of 20% of 220 million, you may be talking of 40 million. That is far more than many countries in Africa. So number one, Nigeria may carry highest burden because of our population. But it's not only that. When you talk of vulnerabilities, we say vulnerability is enhanced or increased with illiteracy and poverty. And like we discussed, illiteracy, where people don't have sufficient education. We mentioned that insufficient education will put the person at a disadvantage of understanding the phenomenon of malaria. If I want to teach the way we are teaching now, there are a group of people we are talking to, not everybody in Nigeria. There are people who are not educated to understand the language we are speaking. There are people that even when we interpret to their language, the logic behind the understanding, they cannot understand it. So if they don't understand the logic behind it, even when you interpret to their language, or in the first place, they don't even understand what we are saying because they don't understand the language medium we are using, then you have got a bracket of people who will have been much more vulnerable because they wouldn't have an awareness of what malaria is. And if somebody cannot understand it, he cannot take a buy-in into what we are saying, even when we recommend preventive measures. Are we getting that? Also, we established the relationship between having this level of education to being able to explain yourself out of poverty. If somebody has at least basic education, primary and secondary school education, And when we explain things like this, the person can understand it fully. We take a buy-in of the person to implement recommendations of prevention, and that person is sufficiently empowered not to be so vulnerable to malaria spread. But in a situation where the person does not have this kind of level of education, such a person also may not be employable at the same time. If the person is not employable, poverty knocks at the door. Apart from, say, employable, the person may not also be trainable. You know, when you have basic education, you can be trained for a vocation that can give you money. So when we want to implement rollback malaria programs, they need resources. We need resources. The individual also needs resources. In a situation where this person does, for example, if I say to prevent malaria, it's going to be good that your windows and entrances of your house are netted. And this person, to net his complete house, will take 50,000 naira. And there are a group of people, there are people in Nigeria where they have not earned 50,000 naira in 3 months. Okay, if I don't earn 50,000 in 3 months, do you think it can be easy for me to borrow 50,000 to net the house?
Not at all.
Not at all. If we say, okay, another way to prevent malaria is to use insecticide-treated mosquito nets. And for one person, I need one. For 3 children, I need 3. And for my wife, or let's say myself and my wife, we need 1. And 3 children, we need 3, depending on where they live or whether they live in the same place. An average insecticide-treated mosquito net may be going for 2,500 for one. By the time you want to buy 4 or 5, you are spending average of 15,000. If I have not got savings of 15,000 in 3 months as a person, how do you think it will be easy for me to implement all these preventive measures? So where you have high burden of poverty and high burden of illiteracy, vulnerability to malaria transmission and spread is increased. And in all of this, which one is not associated with Nigeria? Whether you talk of increase in population when you do enumeration, whether you talk of high level of illiteracy, whether you talk of increase in poverty level, and so on and so forth, which one is not associated with the society we find ourselves? And that's the reason why we carry heavy burden of malaria.
Wow, wow. Well, viewers, I hope you're really learning, because I'm actually learning quite a lot from Dr. Sunday here, who has been breaking down a whole lot of these things we actually didn't know. Did you know malaria had different strains? Did you know that Nigeria has been, one of the highest countries that shoulder this burden of malaria? Well, we are still on Health Watch, and I just want to ask Dr. Sunday here now. You talked about you talked a little about prevention. We're definitely going to come to prevention,
Yes.
but I want to know, for a parent whose child suddenly comes down with symptoms late at night, and like you said, poverty is knocking everywhere, the parent can't rush that child to the hospital, what first aid can such a parent give to the child, or even to an adult?
Thank you very much. This is also a very germane question. There are some disease conditions, that you cannot attempt to do anything as a non-professional. But with the peculiarity of Nigerian society, where which we know that even our primary health care are not ubiquitous, they are not everywhere. And people come down with a lot of conditions at night where they cannot even move to the nearest hospital. So malaria has been taken from that kind of condition that you absolutely need a professional to a kind of disease that you can start doing something based on the knowledge you have till you see a professional. For example, malaria medicines are classified as over-the-counter medicine. This in Nigeria that we have, over-the-counter medicines are medicines that you can purchase or pick without prescription of a medical practitioner. Meaning that when that malaria strikes in the middle of the night and you are far away from reaching a healthcare professional, there are little things you can do. One of the symptoms you will see is increase in body temperature, vomiting, and the rest all of that for small children. For adults, chills, you may be shivering, you may have increase in temperature. Of course, we also know that increase in temperature can also cause another thing like convulsion and the rest of all of that. So it is expected that one, you start treatment. One, you start with paracetamol in order to take care of the temperature when the patient is not vomiting. And if you have a malaria medicine close to you, then you give in the right doses that you may know. So that's middle of the night. In the morning, the first thing you should do is to seek the assistance of a professional. With that, they will be able to take a look at what you have done, try to see whether it is actually malaria or not malaria, and try to think of what else is the problem. You go to hospital, you go to any healthcare facilities that you see around you, or your primary healthcare center. That's what I think the person should do. And for other people in the same house, say whether should you do a preventive whatever or not. You don't need to do any preventive forever. If they have not been having symptoms, you can take them for testing. If they test and they have malaria, then that's the evidence. You treat. If they test and they don't have malaria, you can give them preventive malaria medicines.
Okay, we're going to really talk about the preventive malaria medicine, but then I'm still particular about this question. In a situation where you don't have any malaria medicine to give, what do you now do? The temperature is too high. We talked about poverty. Yes. There's no paracetamol. There's nothing
absolutely
to give. What do you do to calm the temperature down? Put that child or that adult together till morning.
Okay, thank you. In a situation where there's nothing close to you, for temperature, there's what we call tepid sponging. You get warm water, you put a towel in it and squeeze it, and use the warm towel to massage the body of the baby. That as a way of reducing temperature. While you keep watch on the baby, you do that continuously till when it is morning that you can move out to go and see your healthcare professional. Why I'm answering this question, I'm not answering it to assume that we are in Abuja. I'm not answering it to assume that we live in the city center. I'm thinking of people who are in the hinterland, who are not even accessible, not to talk of healthcare facility accessing them. The people who are not accessible, not to talk of healthcare facility accessing them. I've been to such villages where the next primary healthcare you will need to drive or to take bike for about 3 hours before you get there. That's why I'm answering it like that. But if I were to answer to Abuja dwellers and residents, there's a way I will answer it. But I know that in our country, and those are the vulnerable group actually. It's not you and I in Abuja. The vulnerable groups are in the hinterlands, and some of them are not close to any healthcare facility at all. So what they can do is tepid sponging, and as soon as it is done, they should quickly look for a healthcare facility and professional.
Okay, thank you very much, Dr. Sunday. Well, viewers, I hope you're learning a lot because I am really getting schooled here. We'll go on a short break. When we come back, we'll have more questions for Dr. Sunday. Don't go away.
Did you know Jesus said, "Go ye therefore and teach all nations, baptizing them in the name of the Father and of the Son and of the Holy Ghost"? Did you know ACNN reaches out to all African, European, and Asian countries? Did you know ACNN produces programs that provides Bible-based solutions to your everyday need? Would you consider partnering with us in order to help us reach out to more souls? Then, become a part of ACNNTV Kingdom Investment Partnership. You can be a monthly or a yearly partner. To subscribe, make your partnership payment into this Zenith Bank account. For more details and confirmation of your AKIP subscription, please call +234 703 2656 544. You can also reach us via email. Together, we can reach the world with the undiluted Word of God.
Welcome back, viewers. If you are just joining us, this is Health Watch, coming to you from ACNNTV. And I am your anchor, Promise Njokwa Dibe. Today we are talking about a killer disease, a very giant one, called malaria. Of course, a whole lot of people don't know that Nigeria is one of the countries with the highest cases of malaria and deaths, all from malaria. Well, we have with us Dr. Sunday in the studio here, who is doing justice, so much justice to this ailment called malaria, and then how it can be prevented and treated. So we are going to talk about anti-malaria. We've scratched the surface. Now let's talk about anti-malaria. We've seen you talked about the preventive drugs, and then that's for the treatment. So I want to ask, what exactly are we doing wrong in our use of anti-malaria that is causing resistance to the main treatment of malaria?
Oh, thank you very much. Again, Promise. In the treatment of malaria, or let me put it this way, anti-malaria are medications that we use to actually treat malaria or to prevent malaria. In the course of practice, I have seen a lot of people will come to me. They will tell me, I need anti-malaria. I don't need malaria drug. I need anti-malaria. I keep asking, where are you getting this information from? In the School of Pharmacy, Department of Pharmacology, where we are taught what medications do, how they work. Under that very large topic, anti-malaria, then you have malaria treatment medicine and malaria prevention medicine. So when you say anti-malaria, we are talking of medications that have capacity to stop the multiplication or the ravaging effect of malaria on the body of a patient, whether in form of a prevention or in form of a treatment. So it's good I clarify that on here for now. Okay, what are we doing right? What are we doing wrong? Medications are not just articles of commerce, like many people feel. They are to be taken as prescribed. We say all medicines are poisons. Only the information that goes with them that makes them a therapeutic agent. So it then means that whenever you are given a medicine, a certain information must go with that medicine. What makes that medicine to be a therapeutic, that's an agent that can cure or heal a person, is the information that goes with it. Where that information is violated, you can see the other side of that medicine. In a bad attitude of a lot of patients, where they are told to take medicine in a certain way, they take it the way they like. We call it non-compliance or not adhering to instruction about medicines. Chloroquine was phased out as a common anti-malaria because of resistance, and artemisinin-based medicines became, the master stroke in the treatment of malaria. But over time now in Nigeria, by this same attitude of not complying with how a medicine should be used, we have seen a lot of resistance being developed to the first line medicine, which are artemisinin-based anti-malaria. And when we have this, what we have is treatment failure. And when we have treatment failure, it has its own implication in different ways. For example, if a patient is admitted in the hospital for malaria, and the strain of malaria that the person has caught is a resistant strain from a certain source, that's a patient who has misused anti-malaria over time, you will find a situation where the common medicines will not also work for this new patient. A professional would think he's already treating, but he never knew that he's not achieving any result. We have lost a lot of lives due to this in the hospitals. We have also incurred more costs of treatment than we should. A patient that should stay 3 days in the hospital will now eventually spend 7 days in the hospital. And by the time they put the bill of the patient together, they bill you per night that you sleep. Where you are supposed to pay for 3 nights, you are now paying for 7 nights because your medicines or the medicines that are prescribed are not working just because of development of resistant strain of these plasmodial organisms in the treatment of malaria. So this has been a big challenge, and that's why you also see one of the days that WHO has celebrated, like we are celebrating the Malaria Day, is World Antimicrobial Day, in order to drum up awareness for resistance being developed to antimicrobial agents like anti-malaria. Anti-malaria, they are one of the groups of antimicrobial agents that when we talk of antibiotics, anti-malaria, antifungi, antivirus, and the rest of all of that. So we have a day that we also drum up awareness for that, selected by WHO. So what am I saying in essence is that what we are doing wrong, one, is that medication no adherence, when patients don't take medicine the way they should take it. That's the very first thing that causes. And also when we overuse the medicines, sometimes we don't have the malaria. That was why my answer was no the other time. You don't have the malaria, but you just feel that you need to take anti-malaria, and you went on treatment of anti-malaria. When you overuse medicine, because we define that one as overuse of medicine, when you overuse medicine, you can also provoke resistance. So with that, we can cause resistance. But beyond that is also the prevalence of substandard and fake medicine. It's also another thing that is quite worrisome in our society. You see, unscrupulous manufacturers, unscrupulous individuals that import medicines, and unscrupulous, let me say manufacturers that mislead professionals. They mislead doctors, they mislead pharmacists, and everybody who use medicines to treat ailment. Why am I saying misleading? If, for example, by standard, a certain medicine is supposed to be produced at 500 milligram, and the dosage of that medicine is 1000 milligram, before you are able to take care of a certain microorganism, medication must be given in a dosage, and it was given in a certain duration. That is, I say, take 500 milligram of this medicine, morning, afternoon, evening. That's 8 hourly for 7 days. That is the dosage regimen that will be enough to kill a certain microorganism. And I prescribe it in the integrity of my heart. I recommend it in the integrity of my heart as a professional. But interestingly, the medicines, when you analyze it, what the manufacturer has put there is 250 milligram. The professional feels is using 500 milligram to achieve a certain result. Unfortunately for him, it is 250 milligram that is inside that particular tablet. So with that, you will under challenge the microorganism. And whenever you under challenge, you are provoking resistance. It's like when you want to shoot a certain human being, for example. You shoot on the leg. When you shoot on the leg, the person falls down. But when the wound heals, it comes up again. His fear towards gunshot will reduce, because he has experienced it before. The second time, he will not. The same thing with this microorganism. When you under challenge them and you cannot kill, all you do is to kill them halfway. There's what we call a resurgence. They come back to life. And when they come back to life, they change their lifestyle to the extent that that kind of medicine cannot work for them again. So you have a situation like that where substandard and fake medicine becomes a big deal. And of course, you know, in our society, in Nigeria, that is a big problem. Well, we can also talk of wrong information when medicines are dispensed. Medicines do have interactions. There are medicines you must not take with some certain food. There are some medicines you must not take together. There are some medicines you must not take with a certain disease condition. When all this information are not properly, for example, artemether-lumefantrine as a kind of anti-malaria will do very well when it's taken with a fatty food. But instead, when you are not told, or that you need to be told about a medicine, you may not observe all that is necessary to be observed, then you can have treatment failure. So if artemether-lumefantrine will be well absorbed when it is taken with oily food, that's fatty food. But they didn't tell you, and when you get to, you find the orange, and use orange to take it. You must have, by that, reduce the efficacy of that medicine. The extent of that medicine that will eventually enter your blood will have been reduced. And when you sub-challenge, because you can also under-challenge through taking medicines that will not make your medicine to work, or food that will not make your medicine to work. In that case, the microorganism develop resistance also. So we can mention as many as possible reasons why some of these medicines may not work. But resistance is a big deal, and in our kind of medical practice and facility, we need as much as possible to take a look at it.
Wow, that's really so in depth and detailed. So I wanted asking about mothers who give their children, anti-malarials before they go to school. But then
Yes.
you've actually answered part of it. I don't know if you still want to chip in something.
Yes.
Is it advisable? Because you've already said when we're not sick, no need of taking it. But then our children are going away for like
Yes.
3 months. So is it advisable to, give them that as a protective measure so that they don't come down with malaria when they are in school?
Yes, it is permitted to do preventive malaria treatment, not curative.
Okay.
In this case, I, as a father too, one of the things that can make performance of a child to drop is sickness in between the term. Or in between the semester if it's a university student. If a child goes or leaves home and in the middle of the term, the child has about 1 week and the child is sick, the performance for that term is likely going to drop, because that's the peak where they are taught many things, probably preparing for their continuous assessment, and many things can go wrong. So, and we know that the commonest ailment that we have here is malaria. Nearly children under 5 or even above 5 will come down with malaria 2 times or 3 times in a year. So we know that quite well. So in order not to misuse the medicines, there are provisions for preventive malaria treatment where you use only medicines that are for prevention. Okay. Prevention is not for only those children. If you live abroad and you are coming to a malaria endemic area like Nigeria, and you know that you are coming in the rainy season, many of them will have to take preventive anti-malaria before they leave or immediately they arrive. And when they are leaving, they do testing to see whether they have malaria in their blood. If they don't have, they can take a preventive malaria medicine also while they are going back. The challenge abroad is that they usually don't have medicines for malaria treatment, and their doctors don't know exactly how to handle malaria. So when you have malaria there, it's a big problem. So preventive malaria medicine is not for only the children, it's also for adults. Even for pregnant women, they are given preventive malaria medicine. So doing such prevention is not out of place.
Okay, so we've talked about malaria. Please, is this thing called malaria preventable? If yes, how? Then I'm going to add another question. Are there initiatives or programs, that have been successful in addressing the malaria burden and, access to healthcare in Nigeria? These 3 together.
Okay, thank you. Talking about prevention of malaria, it's a collective thing. And it's, we have first and foremost established vulnerability, what makes us to be vulnerable to malaria. We've established issues with education, issues with poverty, issues with gender disparity, and issues with human rights, and so on and so forth. So in order to prevent malaria, there are some things we can do, having understood the way malaria is transmitted. 1, take mosquito out of the equation. When you take mosquito out of the equation, you will prevent malaria. And how do you do that? Let's take a look at the reproduction of mosquito. Mosquito reproductive stages and processes, they need moisture. Moisture like water. Anywhere you see water gathered together, or let's say in a small broken bottle around your house, it is enough for mosquito to lay its egg on that water and produce more mosquito. When you have bush around your house, the bush will provide a calm environment. Under the leaf can also collect water. It is enough for mosquito to lay its egg in those small water and so produce more mosquito. When these mosquitoes are produced, usually they are more during rainy season because you have enough water. During the rainy season, even you have more mosquito, they will find a way to enter into your house, either through your window or through your entrance door. When they get into the house, they bite more during the dusk to dawn, that is, at night to early in the morning. So what they do, they find a way of entering into your house. Then, if they find a way of entering into your house, even when they are available, if you find a way of preventing them from entering into your house, then you will have prevented mosquito bite. When you take mosquito out of the equation, you will take malaria out. So when they get into your house, they bite. What can you also do when they have entered? Is that if you can fleet that house as often as possible, you are likely going to take mosquito out of the equation. Apart from that, is that if you are going to, so let me now enumerate and highlight them now. One is that clear the bush that you have around your house. Let there be no overgrown bush around your house so that mosquito will have no breathing space for you. Number two is that clear all the refuse, including broken bottles. Sleeping under insecticide treated mosquito nets is very important for pregnant women, for children under 5, and for everybody who would like to prevent malaria. And I also said, when we have opportunity to travel out of our normal house, where we may go to a place where we are vulnerable, we may need to use a mosquito repellent cream to rub on our exposed part of the body in order not to have a mosquito bite. It's always very important to mention that taking adequate sleep, taking adequate rest, and eating, naturals such as fruit and vegetables will help to heighten our immunity, and that can increase our resistance against malaria, spread and invasion or whatever. So that's about that. The government, that's the role of government in preventing it now, may need, because in massively preventing malaria, apart from individual level, it is it needs a lot of resources. For example, there was a certain program we call Rollback Malaria, which was an initiative from I think WHO to federal government. Of course, you domesticate some certain policies and initiatives like that. So Rollback Malaria. In Rollback Malaria, which is one of the successful programs of government, the program targeted distribution, massive distribution of insecticide treated mosquito net for nearly an average, let me say, for children and pregnant women. And of course, if that happens and people really know the reason why they should use it, and all of them use it, you can do about 50% roll back malaria. That's give a setback to malaria spread. That's one that actually been successful. However, as it is enshrined in the 1999 Constitution as amended in Nigeria, Nigerians have what we call fundamental human rights. And one of them is that we have rights to life. We have rights to dignity of human person. And under dignity of human person is right to education and right to health care. So if we have a constitution that says that, it then means that malaria treatment, malaria prevention, and malaria control and eradication should be seen as a form of human rights. If any government is not investing in that, it can be seen as the person is violating human rights. And with that, we'll be able to roll back malaria as much as possible.
Okay, thank you very much. We have so much to talk about malaria, but then time is not really on our side. Now, when you were talking, lastly, you talked about fundamental human rights. You talked about education and all that. So I just want to ask, what ways can this education and awareness campaign promote distinct approaches to malaria prevention and care? Now, I also want you to merge it with your last words, as in your advice for Nigerians, especially those living in malaria-prone environments.
Thank you. The role that education and enlightenment can play. Prevention of every disease condition starts from enlightenment and advocacy. in the course of practice as a pharmacist, I've seen that when people are properly briefed, properly enlightened about a condition, especially in communicable and non-communicable diseases, they are able to take care of the situation on their own, even before they run after healthcare professionals. They know what to eat, what not to eat. The person who does not know anything about that disease condition will not be able to know the preventive measures. We have rolled out different preventive measures. For someone that we have not been able to access to teach all of this, or the person who is not sufficiently educated to understand all of this, or the person who is too poor to implement all of this, that person is vulnerable. So, in this case, community engagement and advocacy has a great role to play. In fact, when we want to think of prevention of malaria, 50% of effort should be channeled towards education, enlightenment, and advocacy. And how is that done? That can be done through community engagement. Community engagement can be done through engaging the traditional rulers to reach out to the communities and religious leaders, to reach out to the group that they superintend as religious leaders. So if you can do community engagement and advocacy, 50% of malaria cases will have been rolled back. And how does that happen? To tell more, is that when an individual is sufficiently educated, for example, myself now, there's a certain, let me not give that example now. If I know about malaria, I know that netting of my house is going to be very important. While I'm building a house, I'm also putting money together to put appropriate nets. Okay, but if I do not know that that can be a source for malaria to enter my house, it's not necessary and I will not have to budget for that. So when I know about it, I will take a step against it at my individual level. And at government level, government will roll out a lot of programs being financed, and by doing that, they will be able to prevent malaria. I think that on that. In terms of my final words for Nigerians who live in a malaria-prone environment, I want to advise them that they take advantage of every possibilities where they can get educated and enlightened. Like we said, when you know about it, you can prevent it. When you don't know about it, ignorantly you walk into it and become a victim. Malaria has claimed a lot of lives. In Nigeria, look at the statistics that you put at the introduction level and how many lives we lost even last year, last 2 years, and that's how we lose those lives every year, year in, year out. So I would say, first and foremost, take advantage of the available enlightenment programs and education. 2 is that prioritize your health over and above material acquisition. For you will need that body to achieve whatever you want to achieve. If I have money to build a house, I should also have money to put a net on the window. Because I know I can afford the net, that's why I'm able to build the house. But if I don't know about it, I may not do it. So let's prioritize our health over and above material acquisition. If that is well seated in our mind, we will take the right step. To prevent malaria is not difficult, it's not too expensive if you put it at the top of our agenda and priorities.
Well, thank you very much, Dr. Sunday Olatunde. He said it all. Prioritize your health. To prevent malaria is not difficult. Thank you very much, Dr. Sunday. We've really learned a lot from you, and I'm sure our viewers out there have a whole lot to take home, and then we'll keep spreading the gospel of how to eradicate malaria. So malaria remains a significant health concern in Nigeria, with a high burden of cases and mortality rates, especially among children under 5 and pregnant women, like he rightly said. Efforts to combat malaria in Nigeria have included widespread distribution of insecticide-treated bed nets, indoor residual spraying, and access to prompt diagnosis and treatment. However, we need to tell ourselves the truth that more needs to be done to address the root cause of malaria, including poor sanitation, inadequate healthcare infrastructure, and lack of awareness. He mentioned it rightly. Other challenges such as drug resistance and inadequate healthcare infrastructure continue to impact the progress of eradicating this thing called malaria. Now the big question is from ACNNTV, what solutions do we prefer? We say a continued investment in research, prevention strategies, and healthcare infrastructure is crucial to reducing the impact of malaria on the population of Nigeria. And I want to tell you that by working together, we can reduce the burden of malaria in Nigeria and create a healthier future for all. Thank you very much, viewers, for joining us today. My amazing viewers, you are really, really awesome. We wouldn't have done this without you. And I'll still say thank you very much again to our wonderful guest, Dr. Sunday Olatunde, for coming to talk to us. Until we come your way again with another interesting episode of this program, stay blessed and bye-bye.